Wondering how to make a baby beyond the obvious? Then it's time for a quick biology lesson, starting with ovulation. Ovulation is a brief window each month when your body releases an egg and is open for the business of fertilization. But how do you know exactly when during your cycle your window is open? That's going to take some math. If you have a pretty regular cycle that's about 28 days long, chances are you'll ovulate around day 14. Is your cycle longer or shorter, but still consistent month to month? Even then, ovulation is likely to occur about 14 days before your next period, possibly as few as 12 days. So if you're counting on conception, your best bet is to count back about 14 days from your next period and get busy. Not a betting woman, or your cycles always keep you guessing. Take your clues from your body. Ovulation can cause crampiness, aching, or pain in the lower abdomen. Get up close and personal with your underwear, and you may also notice that your discharge, aka cervical mucus, has turned clear, slippery, and stretchy, kind of like egg whites. Don't want to mess around with mucus? Use an ovulation prediction kit, which tests the hormone levels in your urine to alert you when you're most fertile. There are also bracelets and other smart wearables that can help pinpoint the big O by monitoring your temperature or your saliva. Have a handle on ovulation day. That's the best day to make a baby. Though because sperm are patient waiters, you may score a fertilized egg even if you start having sex 3 to 4 or even 5 days ahead of ovulation.